de interesse o tema desta sessão. O meu nome é Nuno Leite, sou diretor de negócios de comércio virtual. Encontrando a questão aqui da RB da Microsoft, portanto, nós temos um relacionamento com mais de 20 anos. Portanto, os produtos ESG estão profundamente integrados com os produtos e serviços da Microsoft e implementados na cloud do Azure. A Microsoft trabalha e reconhece a ESG como seu parceiro líder na tecnologia espacial e no qual aposta para oferecer valor aos seus clientes corporativos. Em Portugal, a nossa relação também já tem vários anos e é transversal aos setores em que atuamos, seja no setor público ou privado, na administração central, na administração local, na defesa, na segurança, utilities, transportes e também na saúde. O software ArcGIS ajuda os utilizadores a desbloquear a inteligência da localização nos seus dados de negócio. E ao verem os seus dados no mapa, os utilizadores podem tomar decisões mais informadas e mais rapidamente. É isso que se faz nos diversos setores, incluindo o setor de saúde. Então, a visualização e a análise espacial dão contexto às operações e a inteligência geográfica permite destacar lacunas na cobertura de serviços de saúde, em função da população e da procura, analisar as áreas de saúde, suportar a gestão de meios humanos e materiais disponíveis em cada área hospitalar, assim como adequar a procura e a oferta, ou a procura face à oferta de serviços de saúde, em cada centro hospitalar, ou mesmo entre centros hospitalares, procurando sinergias que otimizem os meios disponíveis. A utilização dos sistemas de informação geográfica conduz a melhores resultados na gestão da saúde, a uma maior acessibilidade aos cuidados de saúde e pretende-se também com isso ter comunidades mais saudáveis. É sobre isto que a minha colega Esther Garrity nos vai falar hoje. Como tirar partido das ferramentas da análise espacial para encontrar respostas, como revelar padrões ocultos nos vossos dados, como ganhar novas perspectivas que vos permitem otimizar os serviços de saúde. Para isso, vai recorrer a casos de uso de outras organizações, portanto, neste caso, o contexto da saúde, e mostrar a aplicação da tecnologia num contexto mais próximo da vossa realidade. Esther Garrity é Chief Medical Officer e Diretora de Soluções para a Saúde na ESG. Anteriormente foi vice-diretora do Centro de Estatísticas de Informática da Saúde do Departamento de Saúde Pública da Califórnia. Liderou os registros vitais do Estado da Califórnia e os programas de informática da saúde pública, incluindo a implementação de serviços de partilha de dados e informações entre serviços de saúde, dados abertos e interoperabilidade. Enquanto professora associada de Medicina Interna na Universidade da Califórnia, conduziu pesquisas sobre a abordagem geográfica para influenciar políticas de saúde e promover programas de desenvolvimento comunitário. Além dos seus diplomas em Medicina, Informática Aplicada para a Medicina e Saúde Pública, a Dra. Garrity é também profissional certificada em Saúde Pública e profissional certificada em Sistemas de Informação Geográfica. Sem mais demoras, vou passar a palavra e dar assim início à sessão. A partir deste momento, vamos passar para inglês. Well, concluding this introduction, I say, now we'll have, you do the presentation. And in the end, we'll have some time for discussion where we expect some questions from the audience, either to clarify any subjects from your presentation or to address a related topic that any of the audience have from their particular service, or how can a geographic approach help them optimizing their operations. So questions can be done in English, or if you prefer, you can do it in Portuguese, and I will be available to help with the translation. Esther, your time has come, and the audience is waiting for your wise words.
Obrigada, Nuno. And that's the extent of my Portuguese. I'm really happy to talk to you, especially to be back in your beautiful country. My husband and I had the chance to walk the Camino in 2019, and we really couldn't wait to be back here and enjoy the wonderful hospitality and beauty of Portugal. So I'd like to give my own brief introduction of myself, and I thought I'd start from the beginning. I'm just kidding. So I began my career in academic medicine, where I was focused on really spatial epidemiologic methods, so I could look at issues like ultra-low volume public health pesticide spraying and whether or not that was safe for populations. The good news is, it turns out, it was pretty safe by my research. But then I looked at things like the association between agricultural pesticide use and autism spectrum disorder. Turns out the results weren't as good there, I'm afraid. And I used GIS to assess youth vulnerability and youth well-being in the Sacramento, California area. And I looked at associations across place and health outcomes like diabetes control, variations in the use of certain medical treatments, and even the way that telemedicine programs are placed. Then in 2013, I became the deputy director at the California Department of Public Health, and I ran the Center for Health Statistics and Informatics. And while I was there, I was leading the state's open data movement, and I participated in health information exchange and building what we have in the US, a set of regulations around meaningful use. And I had to build the public health infrastructure to support that. And I also worked on modernizing the state's vital record system. Now, for the last 8 years, I've been the chief medical officer at Esri, where I've led strategy and messaging for our Health and Human Services division. And as you can imagine, we've been especially busy over the last 2.5 years, as we all have in health. And in fact, my new book called Learning from COVID-19, GIS for Pandemics, has just been released, actually just 2 weeks ago. And it details how GIS was used to support pandemic response around the globe. And you might actually have recognized the cover of this book. It came from the Johns Hopkins University COVID-19 dashboard, the world famous dashboard. This is actually the most viral map-based application in history, but it also, for many people, served as the entree, the beginning of their understanding and knowledge of GIS and how it might be useful. So that's a very brief introduction, and it's really my honor to be here with you today. So the way that I'm going to approach the presentation today is I want to give everybody a baseline, since I don't know where your interests and knowledge come from. I'll talk about geography, GIS, geographic information systems, and the importance of place to health. Then I'm going to talk about various different kinds of use cases so that you can relate to how others are using this in population health and equity, in organizational strategy, and in indoor operations. Then toward the end, I want to give you a sense of what have we learned as far as best practices? What are the keys to success if you're going to implement a geographic approach? And then, as has been discussed, we'll have plenty of time for questions and discussion. So let's dive right in. Sometimes we call our work the science of where. And in fact, where questions are incredibly common. We might ask, where's the problem? Where are things changing in the world? Where should we locate a new resource? So if you listen closely, you're going to come to realize that people are always talking about the word where or location in one way or another. In fact, it turns out that in the English language, where is the most commonly used, is the 110th most commonly used word. I'm sure onde is also very common in Portuguese. How'd I do on that one?
That's good.
Okay. So I would say that no matter where you are, where is an important concept. And that concept of where is realized through the science of geography. So let's just think about geography for a moment. It is truly the science of our world. Geography provides all of the rich content for our world. So think of, there's biological content, ecological content, sociological content, any of the ologies that you happen to like or study. And we put that content into context by using a common reference system that we all know how to speak, and that's geographic locations. And the geographic lens really helps us to more easily see and digest complexity and relationships and patterns. And actually, I think that it's the ability to assimilate really massive amounts of information in a map that at least in part explains why so many people love maps. And this geographic science really helps us to understand and to intelligently respond to all sorts of challenges. So then when we pair that science of geography with modern technology, the result is a GIS, a Geographic Information System. And like any information system that you're familiar with, it uses computer hardware, software, and tons of raw data to develop understanding and inform our actions. But specific to this type of information system, we use it to explore the fundamental principle of geography, that location is important in people's lives. And in fact, at Esri, we believe that people can do all sorts of amazing things with applied geography. Things like our topics of the day, identifying disparities and promoting health equity, building an organizational strategy that's smart, and streamlining business operations. GIS technology is really designed to meld data with maps and apps to be able to visualize and analyze the world, find meaning in our data, and make those smarter decisions. That geographic lens offers a very different kind of perspective maybe than we're used to. I think of it as kind of like a telescopic view of the world. I think in health, we've gotten really caught up and maybe even overly focused on the microscopic perspective. And sometimes we forget that everything happens within a context. When we bring these views together, the telescopic and the microscopic, then we can develop a much more holistic and accurate understanding of who we really are. That telescopic view is really important because when it comes to our health, it's been shown that 80% of our health outcomes are context driven. So it's our physical environments, our socioeconomic conditions that influence our personal behaviors, and all of these determine our health status. And that puts, as you can imagine, a lot of emphasis on our communities because they really create those contextual circumstances that have such a powerful impact on health. And while I admit our communities can't curb our cravings, though I wish they could, they can craft the choices that are available to us. And certainly our communities can't change our eye color, but they can change our vision and the way that we see and behave in our world. When it comes to our health and our well-being, it's been said that our postal code may be more important than our genetic code. So ask yourself, what is the first step for a diabetic patient to be able to take their medications? Well, it might actually be having the transportation to go and get them. Now, we can use population statistics and that kind of data to better understand where there are high proportions of households with no vehicle access. Maybe it's not the will to eat better that's scarce, but actually, maybe it's access to grocery stores with fresh and wholesome selections that might be out of reach for some people. And in our modern world, it's not hard to find out whether there are grocery stores available within a 10-minute driving time or a designated walking time for any community. And while every community might not have a fancy gym available to them, we know that a population can flourish when simple sidewalks are available. People need safe places to walk, and there are several cities in the world that have made that safety determination of their sidewalks, one sidewalk at a time. Now consider this. It would not be at all unusual for a doctor to recommend that a patient get more exercise, right? I mean, I've done it myself thousands of times, but as we make those recommendations to our patients, maybe we don't realize that this graphic, this picture, could be that patient's reality. Maybe they have to walk along major highways that would put them at risk for injury or asthma exacerbation from automobile exhaust. The doctor's recommendation really needs to be grounded in a context if it's going to be acted upon by that patient. So place definitely matters in health. This is nothing new, actually. Hippocrates, the father of medicine himself, noted in 460 BC, a long time ago, that where people live and the environments around them have a significant impact on their personal health and outcomes. So again, this is an age-old idea that's just recently coming to the fore. So you might ask, why is it happening just now? Well, because without technologic support, it is really just too difficult. Okay, then, so how does all of this work in a technology world? Well, let's start at a high level. We begin with really simple questions about where things are located in the world. So where are the hospitals or the clinics, the labs or the pharmacies? Where are our patients, the community services or the health hazards that might be affecting an area? Placing things in that geographic context almost in a way magically brings those things into immediate perspective. And then we can ask questions about what's nearby. How close are new mothers to supportive services like nutrition programs for low-income families? Here's another nearby question for you. How much does COVID transmission increase in areas of high population density? That's still a nearness type of question that geographic analysis can answer. Now, in real life, we recognize that things are certainly connected to other things, and we need to understand those connections if we want to make faster, more accurate decisions. So let me give you an example. Homelessness can be connected to injection drug use, and both of these populations tend to use public restrooms really frequently. Okay, so you're wondering where I'm going with this, I'm sure. Well, when you know the location of things, what's near them, and how they're connected, you're going to be able to make better decisions when something like this green area happens, like a hepatitis A outbreak in a community. So hepatitis A is commonly seen in the injection drug user community, and it's transmitted by the fecal-oral route, which is why public restrooms are of interest. So this is actually a very real scenario. The city of San Diego in Southern California really understood all of these interactions and interconnections. So when they had a really large hepatitis outbreak in their city, they quickly discovered what the underlying cause was. It was that overlap of the homeless community and the injection drug user community. So as a part of their response, they mapped every public restroom in the city and they put them on a twice daily cleaning schedule. And they added hand sanitizing stations to the homeless encampments throughout the city. Now, this is a relatively simple intervention, but it was extremely powerful for San Diego and helped end that hepatitis A outbreak. Now, the world is not as simple as that example. We know that. In fact, it's quite a bit more complicated. And if we're going to improve our future and ensure health equity for all and be more resilient to future health threats, then we need to start looking at the world as one single ecosystem, appreciating and considering all of its highly interconnected parts. Now, GIS can help us organize massive amounts of information, and it provides a framework for understanding and applying knowledge. So I personally believe that despite Hippocrates and others extolling the value of place to health, we simply couldn't have effectively applied that knowledge until the technology caught up. And in fact, it has. So now I'm going to not get very technical, but I wanted to show you just a few slides that are going to give you a sense of the breadth of this technology. Now, in a very real way, the technology mirrors the ecosystem approach that I just mentioned. So what is an ecosystem exactly? Well, in the traditional sense, it's a biological community of interacting organisms in their physical environment. Now, this term ecosystem, you may know, was coined by a British ecologist named Arthur Tansley in 1935 to recognize this whole integrative system. And in simple terms, when we talk about animals and plants, we also have to talk about where they live and where they function. But as I've implied, the term ecosystem is now being used in a completely different field, technology. So tech ecosystems are interconnected sets of services through which users can fulfill a variety of cross-sectional needs in one integrated experience. A digital ecosystem is a group of interconnected information technology resources, that's kind of a mouthful, that can function as a single unit. So here's a familiar tech ecosystem. Most of us use Microsoft products, and we know how all of those various tools from Teams and SharePoint to Microsoft 365 and Power BI work together in the Azure cloud. That tech ecosystem is enhanced with a set of ArcGIS tools that work seamlessly with the Microsoft tools, including ArcGIS maps for Office, for SharePoint, for Teams, Power BI, and more. So in the tech world, we want our various applications to work together and expand on the capabilities of each organizational ecosystem. Now, the ArcGIS system by itself is a tech ecosystem as well, just like the Microsoft ecosystem. At a high level, it is a system of systems with three fundamental parts. There's a system of record for your geospatial data management, a system of insight for any of your analytics, and a system of engagement, which is how you connect people to the data and information and apps that help them to communicate and to understand. Now, these systems are all interconnected with lots of maps and apps that support your work in any environment that you prefer. For example, you might host your ArcGIS system in your Microsoft Azure environment. Okay, well, now that sort of covers the basic understanding of geography's role in health and how a GIS can potentially support that work at sort of the higher level technology point of view. And now I'm going to move into the three areas that I really wanted to cover for you today with lots of use case examples. So let's start with managing population health and equity. Okay, so there are several ways that a health system might approach this topic, but it all centers around the idea of finding patterns in the community that lead to disparate health outcomes and then determining what can be done to make improvements. So I wanted to give you a simple example. This is one of my favorites. I think it just tells the story so well. So what you're seeing here on the map is a health outcome. It is low birth weight babies. The darker red postal codes in the state of South Carolina shows higher rates of low birth weight babies. Now, first, we can apply some analysis to better see the pattern that that data provided and determine its significance. So in red, we can feel very confident that we have a statistically significant hotspot where we have a number of low birth weight babies that's higher than we might expect given the entire population rates of low birth weight babies in the entire state. Now we have this red area that we can focus our efforts on. But I do always like to remind people that the area in blue, the cold spots, you don't want to ignore those. Those are areas that are statistically significant as well, but with lower than expected rates of low birth weight babies. So we might ask, well, what can we learn from them? What is preventing the incidence of low birth weight babies in those regions? Well, we might want to think that the low birth weight babies are related to the number of obstetricians who are available in this area, in this case, a state. So we can add that information to the map. Those are the green markers that you see. And this appears to be useful information, but we can really expand on this idea. We can't totally determine if this image, from this image, how accessible those providers are. So we can draw a drive time boundary around each provider. So in this case, we chose a 30-minute drive time, but you could adjust that to longer or shorter. You could make it a walk time, a public transit time. So now we're really starting to see a bit more information. So let me clarify it here. A good portion of our hotspot is in what you might call an obstetrician desert. We show that in orange, a place where there aren't enough obstetricians for the population. So if you were dealing with this problem at that state level, it becomes much clearer where you want to focus your efforts to make the biggest impact with the resources that you have available. Now, remember where we started. It looked like we had nearly the entire state to cover with our efforts, but in reality, we can dive into a much smaller area where the greatest need exists. And in fact, we can do better than that. I feel like one of those Ginzu knife salesmen, but wait, there's more. This is the same area with high rates of low birth weight babies, poor access to obstetricians, but now we've geo-enriched the data with another layer of information. We added a data layer with the numbers of women of childbearing age in each postal code. So that's going to help us to target interventions to exactly where they're most needed. So this workflow had relatively simple but powerful steps. We mapped an outcome. We performed analysis to find a pattern. We added a causal factor related to access, and we geo-enriched the result with additional relevant information to help us make our plans. I'd like to take a minute to talk about the access part of what GIS can do. Access to care calculations are super important. It's critical for basic access needs as well as for critical access concerns like stroke care. In that case, you only have an hour from where you have the stroke to get treatment to save brain function, or cardiac care where minutes can mean the difference between life and death. We need accurate data. So here's an example. Some access calculations are still being done where you start with a postal code centroid and a provider, and you do a straight line distance calculation. Now, in this case, that's 2.5 miles. Okay, you might think that means that it would be 3 to 5 minutes of travel time to get there in a vehicle. But most patients don't live in that postal code centroid, right? Their straight line, or as the crow flies distance, might be longer, it might be shorter. What we really need is context. So neither of these calculations is anywhere near correct since our patients are, let me get that context up for you. There we go. Our patients are unlikely to swim across the river to get to care. So neither calculation is really accurate. What we need is the underlying road network data to get them across where the bridge is. Okay, so now the drive time distance is 6.2 miles. Well, that is significantly longer than the original estimates. So when we then start to consider speed limits and the roads during normal traffic patterns, that can really amount to a significantly longer commute. It can be up to 20 minutes on city streets and across a busy bridge. So doing this right is really critical if we're trying to unmask disparities in access to care. Okay, so one of the most common questions that I tend to get is about data. Everyone's eager to have and use more data. So I just thought I would add a slide to explain some of the data options that you have for using a GIS. So certainly it enables your own organizational data, right? Whatever you have and you want to analyze, you can pull that into the system. There are many open data resources. I know that you have some great open data resources in Portugal, and there's also a global resource that Esri provides called the Living Atlas of the World. I've given the URL here. You can purchase geo-ready data, so already available to put into your system. One example is data that Esri has for sale. I've given you a link to a data browser where you can see what's available for Portugal. And of course, you can always, for particular projects, collect your own data, and the software can help you do that. So I wanted to show you what I think is a really relevant example. Now, we build sometimes for common workflows that we see all the time, solutions. So these are like a series of templates that you can put your data into and just sort of go from there. So this one is actually to help you collect data efficiently. This is called a community health assessment solution, and it gives you the option to follow the World Health Organization's CASPR methodology for selecting a study area and random household clusters so that you can do a community health survey. So it makes it really easy for regular health assessments as well as rapid needs assessments. You might do those in the face of a disaster when you need really quick information. So once those neighborhood clusters have been selected for creating a survey, then you have sort of your operational needs, right? You can assign your field teams to the cluster that they will support, and you can easily make those assignments within the software, provide useful comments to the team, send them information by integrating with an email app like Integramat. And you can even send them a digital map so that they know the area that they've been assigned to and can get there quickly. Okay, then we get to the survey part. This is where we built the app using the US CDC's Bank of Community Health Assessment questions, and that populates the digital survey tool. We also added some COVID-19 questions to the tool, but this survey is easy to customize. You may have different needs. You can add new questions, you can modify the existing questions, you can hide the ones you don't want to use. It's all up to you. Now on the right, we've pre-configured a dashboard that monitors the submission of the surveys in real time. We can see things like how well are the teams doing in terms of their efficiency? Are the householders that they're knocking on doors for being cooperative with the assessment? And then we can see the overall progress towards the completion of all of the required surveys. And then we have dashboards that show the survey results. This one has been pre-configured with population breakdowns by race and ethnicity, by language, by pregnancy, age cohorts, and some financial characteristics. But you can show any of the metrics that are important for your work. I thought I'd show you an example of a community health assessment dashboard from Providence St. Joseph Health. This is a large US health system. They have 52 hospitals. And in this case, they were focused on diabetic patient needs, access to healthy foods, and their local community partners that they've given grant funding to through their hospital's community benefit program. So now they're able to track metrics that are associated with their grantees, their community partners, and see if there's progress in improving diabetic outcomes. So they're really seeing whether they're having an impact. So when you think about it, this assessment tool really just became a strategic effort for resource allocation for their grant program. Now, another way that a health system can think about using GIS for population health is to examine their readmissions problem. Now, this is a vexing and expensive problem for hospitals, and it's often preventable. Now, you might be familiar with a story from the Camden Coalition. It was pretty famous. It was published in the New Yorker magazine by Dr. Atul Gawande. And he wrote this article. It was called The Hotspotters. And in the article, he described how the Camden Coalition, they were based in New Jersey, used GIS to do risk analysis for their readmissions problem. Now, their approach was really unique, and I'll explain it to you in a moment. Okay, well, rather than analyzing the readmissions problem and their super utilizers of healthcare services in the way that has sort of become traditional, which is by disease type, they tried to do something new. So they looked at their most complex patients, regardless of disease type, and then they grouped them. And then they performed a geographic hotspot analysis on the complex group. And here's what they found. They found that many of their super utilizers, in fact, the majority of them, lived in just a few of the area's low-income housing complexes. So what they did was they set up small primary care practices right in those buildings, and that improved the access to primary care, to preventive care doctors, and it helped them manage their chronic conditions. It also helped them with more acute problems like head colds and earaches that saved unnecessary visits to the emergency room. So here's the astonishing return on investment that they achieved. First, they certainly improved the quality of care, while they also reduced readmissions costs by an average of more than 50%. Another great example comes from Children's National Hospital. They used data from their electronic health record to map what they found was a really high number of children, pediatric patients with thermal or scald burns. They found that many of them were coming from the area's Spanish-speaking communities when they put it on a map. And they did a little bit more investigation, and that led them to provide instructions for adjusting home water heaters to safe levels in Spanish. And just that simple instruction sheet passed out to the affected neighborhoods really decreased the problem. So Dr. Randall Bird, who's the chief of trauma and burn surgery, said that Children's National is now seeing fewer burn patients overall and fewer patients that required high-level burn care. So it was a pretty amazing insight. And here's another population health management idea, and this one is kind of focused in a different way. It's on empowering patients with local resources. Now, what you're seeing is a screenshot of the wellness map. This was created by Loma Linda University Health, and it's also integrated with their electronic health record system. Now, through the patient portal, a patient can do several things with this map. They can interrogate locations in the blue section which relate to their own personal health care. So this has their appointments and the locations of those, their referrals, nearby labs and pharmacies and urgent care centers, and that's all right at their fingertips. In the green section, patients can locate the nearby wellness resources. So this might be green spaces, places where they get healthy food options, places where they can exercise. But I have to say my favorite part is the orange part. In this section, patients are able to see the community resources relevant to their own individual health concerns. So for example, if a patient has diabetes, I keep picking on diabetes, they're only going to see the resources relevant to diabetes on the map. So no other clutter, just for their diagnoses. I think that really represents personalized medicine. Okay, now let's change ideas for a while and move into the business of healthcare. Now for this section of the presentation, I'll be showing you data and maps from a particular product. It's called ArcGIS Business Analyst. And you can use many different tools across the ArcGIS platform, but I thought this one was worth calling out for strategic planning because it really has everything you need to do in one package. And let's start with the data. Now this is a screenshot of the data browser, making it really easy to search for relevant variables that you might want to use. You may want information on population size, income and spending habits, age cohorts, occupations, and more. Esri has data available for 139 countries. Okay, so one of the first things that you may want to do is keep a pulse on your vulnerable populations so that you can start to predict where additional resources are going to be needed that your health system can provide. Now, poverty, of course, is an important indicator. And here we can see across the United States the prevalence of poverty at a state level. And the darker purple areas have the highest poverty levels. Lighter colors are showing lower concentrations. And if you see, I've kind of outlined the state of Colorado, it has a comparatively low rate of poverty, which is kind of interesting. Now, if we zoom in and we look at the counties in Colorado, we see a little bit more variation in the data. But of course, we always need more granular information. So now we can see the poverty levels by block group. This is a much different view from the state level, and it's really helpful for prioritizing service access for populations that have the greatest need. Now, understanding the here and now, it's often where we're focused, is right now, that's important. But in a health system, if you really want to gain a competitive advantage or be forward thinking, you have to get ahead of the market and you have to see into the future. So you can do things like what
Ashton, you unmuted yourself. You muted yourself.
Okay, thank you.
So we lost your last 1 minute.
Okay. Well, maybe I will go back to here. So what I was saying, this is still the state of Colorado, and we're now down to the block group level. And it's giving us a much different view from that state level where I showed you poverty was low for the state. So this is really important when you're trying to plan localized services for your populations of greatest need. And then when I got to this slide, I was communicating to you that we tend to think in the here and now, and that's really important. But sometimes we want to be forward thinking. Maybe it's for competitive advantage. Maybe it's just to look forward for our populations. We have to get ahead of the market and we have to see into the future. One way to do that is to look.
It happened again. Sorry.
I'm not touching anything. Well, maybe I'll skip beyond that slide. Maybe there's something to do with that. Okay, hands-free. So we can observe community populations. So I've spoken a bit about that, and it's super helpful. But sometimes it's important to examine and evaluate a population in the immediate vicinity of our facility, right? Because we're taking a strategic facility perspective or health system perspective. So using the tools, we can look at service areas in a variety of different ways, and it's defined many ways, and explore and analyze based on those. So you could do something very simple like I'm showing here. This is a hospital in St. Louis, Missouri, and we defined service areas by 1, 3, and 5 mile rings, or you might say buffers, as the crow flies. But I already gave you that talk on distance and what technology can do, so we know this isn't going to be good enough. We can get much more specific. If that hospital's in a densely populated area, maybe it's better to use 5, 10, and 15-minute walking time buffers. They might look like this. For a car-dependent community, a 5, 10, or 15-minute driving time to the hospital might be the most appropriate. So we make our selection and we consider this our hospital service area, and we want to learn more. So we can do what I mentioned before. We can geo-enrich our service area with relevant data so that the health system can understand how its target market is laid out geographically. So in this case, the health system needs to see where there are pockets of high, this is a US example, high Medicare utilization near the hospital. So this map is showing block groups within the 15-minute drive of that hospital area where at least 5% of the population in the age group 35 to 64 have only public insurance. So the darker red areas have the highest concentrations of people meeting this criterion. Okay, now we're gonna move geographically from St. Louis to Spokane, Washington. Here we have a 20-minute drive time boundary, and we want to gain a better understanding of the entire service area population. But this service area is not a standard geographic boundary, right? And it's not a postal code, it's not a district, it's a totally unique geographic area. But it turns out that's okay. We can still geo-enrich this whole unique area with population-weighted apportionment methods, which are highly accurate. So with a service area specific viewpoint, the health system can be more effective in building its strategy. That service area information can be delivered in several ways. So I wanted to give you a little bit more information on that. So first way is a pop-up. So you see the pop-up here showing all kinds of different data that may be of interest. But maybe for your purposes, you prefer reporting tools to produce informative reports and infographics in seconds. And this helps you minimize the time that you take for generating all of those reports, and you can maximize your time that you spend on planning and market development efforts. Now, there are many out-of-the-box templates, like this medical expenditures report. It provides average spending toward healthcare within the Spokane hospital's service area. And you can also create your own reporting templates that would serve your unique needs. So I gave you pop-ups and reports, but also you can use infographics. That's another option for reviewing and presenting your geo-enriched service area data. Now, this infographic template is covering a general demographic summary. And actually, although this one is a screenshot, I wanted to let you know that the digital report is interactive. So you can click on any of these things and dive in a little deeper on each parameter. And maybe you'd prefer this one. This is the healthcare and insurance infographic, and it helps a health system determine their needs and market potential, again, for a given area. Okay, in our travels, so we're going to now go to Florida in the Tampa area. Now, in this case, we have a healthcare organization that wants to build a new facility. Maybe they're constructing it, and they want to focus on serving vulnerable seniors. But before even scouting out their potential locations, the leadership really wants to identify the regions that would best meet their criteria, knowing who they want to serve. So they want to find areas with high numbers of population over the age of 65. They want seniors that use public insurance only. They want to have a certain median household income level, so probably on the lower level. And they want households with no vehicle so that they can better support access in different ways. So they begin by using filtering mechanisms. So if you can see the little filtering tool at the right, keeping only the census tracts in this case where 40% or more of the population is over the age of 65. So they're showing up now in blue. Now, of those tracts, they further filter and keep only the ones where 15% or more of the senior population uses only public insurance. Lastly, they limit the median household income to $50,000, and they require at least 10% of homeowners do not own a car. So we're left now with just a few census tracts that fit all of their criteria and therefore can serve as a starting point for choosing a facility location. So using that filtering tool is really quick and easy, and it's a good way to examine and adjust for all of your criteria of interest. Now, in this next scenario, we're going to move to the region of Raleigh-Durham, North Carolina. In this case, we actually found some candidate locations for our new facility, and we want to compare those candidate locations based on our criteria and see which one would be best for us. The organization this time is a little bit different. We're going to say this is the Public Health Department, and they want to find the best high school facilities that could be COVID-19 testing sites. And so they need a little bit of decision support to do this. So they decide that there should be no more than a 20-minute drive time to get to any testing site. And now they can gather the data. So they've made these drive times. They can gather data within the drive time boundaries for each of the candidate locations. So they are including the total population, the population density, minority population, households below the poverty level. So you can see they're looking at vulnerable populations, seniors over the age of 65, households that have at least one person with a disability, and then they added some of their own health department customized data, like the COVID-19 confirmed cases and COVID-19 deaths. Actually, for this demonstration, we pulled that data directly from the Johns Hopkins University data resource. Okay, so this business analyst product I've been mentioning compares the areas based on all of those criteria, and it scores each of the candidates between a 0 and a 1.0. And so we get a report, like you can see in the bottom right, that makes it easy, first of all, to visually see the top candidates, right? They're in the darker orange-red colors, and you can also see why when you look at the table. So this site selection workflow that I just described to increase the support for vulnerable and underserved populations, it's exactly what this organization called Emerus has done. So Emerus, if you hadn't heard of them, they're the first and the largest operator of small format hospitals and what we call micro hospitals. So they begin the process by identifying gaps in healthcare and having a complete understanding of the demographics, the population, and who would benefit most from a new facility. Now, determining the best location for a small format hospital with co-located services like primary care, it really meant digging into the data from a geographic and demographic perspective. So they assessed how the facility might relieve congestion at other local facilities and improve patient satisfaction. So Daniel Probasco, he is the Senior Director of Strategy and Development at Emerus, and he said that GIS really allowed them to solve the market challenges with a disciplined, data-driven approach that ultimately benefits the communities they serve. And I have to say, I've spoken with a number of hospitals, and I'm afraid that sometimes these decisions have in the past been made by intuition. So we can do better than that now. Now, another part of your strategic planning may be related to recruiting a healthcare workforce to better support your community's needs. So in this case, we're approaching that problem by starting with an analysis of patient access to care. So you're seeing in Ventura, the patients in green have access, but we want to focus on those ones in orange that don't have access. So we may have a candidate pool of physicians that we want to consider. We need internists for this particular area. So we've got two candidates that we've been looking at. We can get information about them from the data source we pulled from. And now we have to figure out how are we going to make the best decision between our candidate physicians. Okay, so soon this will flip over to a little decision support tool. There it is. And so we're going to do two scenarios, one for each doctor. So we're going to put a marker where their practices are. And now we're going to do a drive time around each one. We've chosen a 20-minute drive time using live traffic information. So during regular business hours, and we will rename that file, and then we'll run the analysis. And what you're seeing in the background with the hexagons is just the aggregated population of people who did not have good enough access to care. So we still keep them in mind. And what's going to come up in just a moment are the purple drive time areas for each of these scenarios. They take just a few seconds to run. And we can see the one on the left has succeeded, and you'll see that area pop up. And we really just want to focus on that drive time area. So we'll eliminate the background in a moment, but we'll let the one on the right come up first. Okay, so now we'll sort of look at those two areas and make some comparisons. So because we had all of that underlying data for our patients that didn't have good access, we can now look at it at the bottom in a different way. So if you compare the two doctors, one could potentially serve 312 members, while the other might serve 288 members. But we also created like a vulnerability score. In this case, it was a travel burden score. So now you have maybe a little harder decision. Are you going to go for the more vulnerable population that serves fewer members, or the population that where more members are served, but maybe they're not as vulnerable? That would be a health system choice. But all of this data you can download and use. So I really like that example. But I also wanted to share the work of Texas Children's Health Plan with you. They have a project. They're based in Houston, you know, where all of the NASA flights take off. And so they call their project Mission Control, which I thought was kind of cute. But they bring all of the aspects of patient care into one view, and they built it on a foundation of location. So they began in their first year by just mapping the patients, the providers, and their service areas. But then by year 2, they were getting really good and they kind of went wild. So in their implementation, they were doing advanced analytics around accessibility, around site selection and mobile health services, where they send nurses out into the community. That's to prevent readmissions. And then when COVID began, they were like right on top of it, and they quickly deployed our emergency management solution, and they were ready to support their organization with real-time data and analytics. And they did so well that the 2 GIS managers that you see in the picture won a company-wide award from Texas Children's Health Plan, and they also won Esri's Special Achievement in GIS Award in 2020. And, you know, forgive me, I'll name drop here a little bit, but I wanted to let you know that there are large customers who use this software in this way that I've been describing strategically, including the Veterans Administration, the largest integrated healthcare system in the United States with 9 million members, the California Department of Healthcare Services. Kaiser Permanente is a big client, and they're doing innovative things. United Healthcare, Cerner, the electronic health record system, and Optum Home Health, just to name a few for you. So I've covered the population and equity perspective and the strategic planning perspectives. Now we're going to take GIS indoors and see how it can streamline operations within your facilities. So ArcGIS indoors supports operations and mobility by making floor-aware assets accessible, that's a lot of alliteration with A's, through 2-dimensional and 3-dimensional maps. And you can use it through mobile apps that are indoor location aware. And it's compatible also with any of your indoor positioning systems. So by making hospital floor plans and assets digitally accessible to those who need it, you'll see that you can do lots of amazing things. So let's start with wayfinding. As you may know, nearly half, I would say more than half, of patients and visitors lose their way in hospitals. Literally, I've never walked through a hospital I worked in without somebody asking me for directions. And it turns out that thousands of hours per year are spent by hospital staff trying to direct people through the complex maze of corridors. So in an average hospital, somebody calculated this, the time is roughly equivalent to 2 full-time equivalents, FTEs, annually. That adds up. Not only does this take, of course, staff time away from other important duties, but getting lost turns out is a top complaint by hospital visitors. And that, of course, can impact your satisfaction ratings. Now, with indoor GIS, you can provide comprehensive wayfinding to visitors and staff using turn-by-turn navigation, even with consideration of people that have disabilities. And you have the ability to control who should have access to where. Now, visitors, of course, don't have the same kind of access to all parts of the hospital that staff would have. And wayfinding in hospitals really goes beyond simple directions from a kiosk, which some hospitals have. People can use the mobile app, a nice mobile app that provides walk travel time and the ability to search for nearest points of interest, whether you're looking for the bathroom or the cardiac intensive care unit. This can really minimize late appointments and help clinics run better. So I have a little video for you here to show it in use. Let's see if I have to start it. Yes. It does have one. I can talk over it? Okay. So sorry if you hear two voices, but hopefully not. Basically, we're showing our cafe on the Esri campus. This is not a hospital, but we didn't want to use a hospital. And we can see attributes about different locations, what they are, what they're for. Okay, so now what we're looking at is the floor-aware nature. And if we're looking at just the third floor, you'll see, you saw in gray, different buildings that didn't have a third floor. But what we really want to do is navigate from one place to another. So we want to go to a particular conference room. Maybe we have a meeting in a hospital. This may be a clinical appointment. So here's the conference room that we want to find. So we simply click on the little arrow there to get directions. And we can say where we're coming from. But it should recognize your location. Okay. So you see the dotted line, and the dotted line is indicating that we're on the third floor in a sense. So we're going to change to the first floor because most of our directions will be on the first floor. And now you see exactly where to go. Okay, so now we get to this building and we're going up to a third floor area. So this is where we can turn on our 3D view. And that'll come up. Okay, so if we look at all of the floors and we sort of tilt this around, you can see how you actually have to walk up the staircase. So that's pretty cool. We're going to go back to 2D, and then we're going to say, okay, we're not walking, we have a disabled person and they're using a wheelchair. So in that case, it's going to redirect you to the elevator and show you how to get there. And again, we can look at the same picture in 3 dimensions. And you'll see how it actually works. That always fascinates me a little bit. Okay, so you get a sense of wayfinding can be really easy. Now, once a system is stood up, it becomes easy to do things like real-time asset tracking. So not just people finding their way, but you can support mapping your fixed assets, and using complementary technology, you can support real-time tracking and even historical analysis of your indoor movement. And not only can you track assets, but you can manage them as well. So mobile apps make it really easy to do things like report maintenance issues, and likewise guide your maintenance staff to the asset with no confusion. And I always thought this would be particularly important for hospital accreditation reviews and being able to do that. Now, while we're talking about real-time capabilities, hospital security officers can get complete visibility of historical and real-time device tracking data so that they can plan for events and they can know where their colleagues are in case of an emergency. So we all know, for example, that hospital waiting rooms cause stress. They're stress points for patients and for visitors, and being able to allocate the correct amount of resources at the right times creates a safer environment for everyone. And of course, all hospitals want to prevent headlines like these. We want to make people healthier and save money. So by taking the floor plan data available and getting a better understanding of what's taking place inside, we can start to provide new insights on how to prevent infections. So you can track and visualize hospital-acquired infections like Clostridium difficile, vancomycin-resistant enterococcus, methicillin-resistant Staph aureus, MRSA. So you can perform analytics to answer questions like, Are there different isolation and sanitation protocols for different rooms? What are the hand washing stations and what type of hand washing is being used? When you create an ArcGIS indoors data model for your space and you feed it with all the right information, your hospital can more effectively plan and operationalize this intelligence. As you know, each room type in a hospital is a cost center. Operating rooms have a very different operating cost associated than telemetry rooms, than general ward rooms or waiting rooms, and so on. So understanding the allocation and the use of spaces really helps hospitals plan and stay compliant with regulations and their audits. And this is just a sampling of what can be done with indoor GIS systems. I have to tell you that in the US, it's becoming one of the most popular things that people are doing. And at this point, so I've now covered a bit about geography, GIS technology, how it can be applied to population health and equity, building data-driven strategic plans, and optimizing operations indoors. That was a lot, but we're not quite done yet. Hopefully, I've inspired you to think that this could be really useful, and maybe you would like to know how to translate that vision into actual results across your organization. Of course, it's about more than technology, right? It's about the people required to make it successful and the process to help build and sustain the adoption of new ideas. And I'm going to do this very quickly, but certainly happy to go into more detail for anybody who would like it. I'm going to cover 5 quick steps, and they are: know what you own, develop a location strategy, get trained, manage change, and get help. Sounds simple. Okay, so know what you own. We find all the time that people will purchase a software. It could be Esri or other softwares. And like I said, it's an ecosystem with literally hundreds, sometimes thousands of tools that you can use, and they don't know what they own. So they buy another tool that they already had within the system. So one way to know what you own is to start to understand different patterns of use that your GIS can do. So it can be used for things like your data management, your field mobility, decision support. There are tools for all of those things. So trying to compartmentalize into just 9 patterns might be one helpful way. It's also helpful to stay in touch with your account teams. They'll always keep you updated with what's new and interesting, to look at different kinds of events that can be educational for you. Webinars are happening all the time, meetups, social media. I post almost every day on Twitter and LinkedIn about what's going on. And I'll have another slide about this later, but there is something called the Esri community, and I'll explain what that is. And I also have provided a link here for you on even just getting ideas about what can be done with story maps. Okay, so next is developing a location strategy. And this is so important. I really liked this quotation from Peter Turla, who said, living your life without a plan is like watching television with someone else holding the remote control. And if you're a control freak like me, you wouldn't like that very much. So we actually have a way of going about developing a location strategy and helping our customers figure this out in a very logical, structured format, going from understanding the needs to creating the plans and the processes to actually acting on it in a really smart implementation operational way. So all of this comes with a lot more information, but again, quick high level. And if you want to make it easy, in health, I know that we all love 2x2 tables. You can start to prioritize what might be good early projects by using a table that compares how challenging the task or the application would be and its overall benefits. So of course, if the challenges are low, so it's easy, and the benefits are high, then I would say aggressively embrace that project. Maybe it's a bundled solution like that community health assessment that I showed you, where all you have to do is deploy it and you're ready to go. Those are ones you want to do. If the challenges are high and the benefits are high, well, you might have to be a bit more cautious about your resources, how long it takes, but you may end up embracing that innovation as well. When benefits aren't as high, but it might be pretty easy, that might be experimental things when there's free time or more resources than you thought you had. And of course, we always want to avoid the high level of challenge and low level of benefit. Now, the next two areas kind of go together, getting trained and managing change. A lot of times when you've set a vision for your organization, you can totally see to the other side, you know what you want to accomplish, but for staff, it might be a bigger leap than it is for you. So we have to help them build bridges to understand and overcome sort of this lack of knowledge or the we've always done it this way kind of thing. So you do that by first building awareness and their desire to make the change, improving their knowledge, their skills and capabilities so that they can move forward across that bridge, plant their flag and be just as happy as you are getting to the other side. Now, sometimes I like to put this in another 2x2 table that I call the skill-will matrix. And so again, we're looking from low levels of skill to high and low levels of will, interest in the project to high. When you have low levels of will, but lots of skill, then all you really have to focus on is change management. If, of course, you have a high level of will, people are interested but low skill, then your focus is on workforce development. If you're low in both places, but you still, of course, need to proceed, then you need to deploy both techniques. And if everything is high, then it doesn't mean you're done. You have to keep reinforcing the great behaviors and the purpose of the project. Now, when it comes to skill, we have found that organizations kind of chronically undertrain their staff, particularly with regard to technology. Knowledge becomes stale really fast in this world, so we can do better. And we provide a lot of resources from e-training, web classes, student licenses, Esri publications, like some of the ones that I'm showing here, the MOOCs, the massive open online courses, all free. And for one that I'm very proud of is at the top, I put a URL for a 37-hour training program for Health GIS. So it's specific to the needs of health and only the technologies that we tend to use more often in health. And that is free for anyone to use and become more skilled. Now, on the will part, there are, of course, many reasons that people resist change. Sometimes it's about communication. Maybe they weren't a part of the decision-making, so they didn't have buy-in, or maybe there's not good support for transitioning to the new way of doing things. I would say in some of my positions, the biggest thing has been people fear redundancy, that their job will go away. So we have to combat that, and it's about people and mindset. So you have to have the right champions, and they have to be focused on the value, the business outcomes, making sure the project is going to be sustainable and not just end at the end of a funding cycle, for example. And very importantly, it really makes a difference who delivers the messages. So I would say the why are we doing this project or changing whatever it is, has to come from the executive, the CEO or whoever's at the top. The WIFM, the what's in it for me part, that needs to be from a direct supervisor to the employee to say, this is why you benefit from being a part of this project. So different messages from different champions. Okay, my last of the 5 keys to success is getting help. And there are many types of assistance that you can get if you're interested in implementing a GIS. So one of the things that I like to tell people is this software was created so that you can configure first, rather than customize or develop, although there are developer tools. But this makes you get to success much faster when it's just sort of a wizard-driven configuration. So start with configuration when you can. When you need help, Esri provides professional services of multiple different varieties. I won't go into all of these, but I wanted to give you a sense that depending on the kind of help you need, there's something out there for you. And I mentioned before the Esri community. This is sort of well, it's a community of people helping each other. And so it's free. You log into the community and maybe you're doing something a little bit unique and you want to see if anybody else out there has done it. Maybe they have some Python code on GitHub that you can use. So it's a really great kind of technical or best practices or question format where you can get up to date and move your projects along. And we have business partners. The Esri business partner ecosystem is quite large, coming up on 3,000 business partners that can also support your work, your projects. And you might not know there's a volunteer community. So you need free help for maybe a not too complicated project. Well, the GIS core from ERISA does global services and they can support projects of all kinds. We've had them in Africa supporting Ebola response, for example. They supported finding all of the vaccine locations or the COVID testing centers across the country. So they crowdsourced that information. So it's a great resource. So those are the 5 steps to be successful. If I've enticed you at all, and I would love to invite you to hold on to my contact information. Follow me on social media. Like I said, I'm posting every day about interesting things that are up and coming with Health GIS. And with that, I've certainly spoken enough, but I'm happy to answer questions.
Well, let's say many thanks for your all the things that you've been sharing while people well, some of the audience get ready to do some questions. I have 2 questions here in the chat. I don't know if you can see them. If not, I can read it to you. One is from Joana Osorio. She's asking, from the citizen point of view, those like smart solutions, will they be able to interact with an app? Is that correct?
Yes. So
with the public-facing
so
information and the educations that we provide.
Yes. So the way that I would put that is that our software platform system is built as sort of a business-to-business kind of solution, but you can create apps that are meant to be used publicly. One great example that I really like is called a citizen reporter. And so your citizens, that whether they're reporting potholes for your public works department or graffiti, or maybe, you know, health-wise, they're looking at things like standing water that might be a risk for mosquito diseases. So that's one way. We also have other ways to crowdsource information, and a lot of times as well, citizens can interact with survey type of apps that you put on your website to collect specific data. We saw people do that to get, for example, sentiments about vaccine interest early in the pandemic. So they used an ArcGIS hub site similar to a website. They put a survey application on there, and anybody could go onto the website and address what they felt about whether they were interested in vaccines. So a few different ways that the citizens can interact.
But definitely they can access, the answer is yes. They can access either through apps or through a website. There are plenty of ways of allowing the health services to engage with the citizen and help within communication information in one way or both ways.
Absolutely.
So we have another question. It's from Rita Marques. She says, having any cases of understanding MS patients to improve quality of referrals?
Specifically for MS patients, I remember a while ago, and maybe maybe you saw this, they were actually looking at causal factors for MS, and they found an association with Lyme disease. I don't know if that's been since debunked, but I would say, you know, one example that occurs to me, something done in Australia, was they created a little application called Blue Bays, and this was for handicap parking spots. And they crowdsourced it across, maybe not across the country, but across the state, as New South Wales, I believe. And And so they got people to say where there were handicap parking spaces so that somebody with MS, maybe who's in a wheelchair and would need to find a parking space that was accessible for them, could easily find it. I would have to think of what are the resources that would be most useful for this population, and then it's very easy to put them on a resource locator. I'll give you another example. It's not MS, but I think you'll get the idea. We have a resource locator for people who are suffering from substance use disorder. And so that resource locator shows where are the chemical dependency centers, maybe faith-based organizations, maybe shelters or rehab facilities where they can stay. They may need job resources. So all of these things to support, getting help for their addiction problems.
Does it answer the question? Do you have any further clarification?
I have one question, Sandra Mateus from Microsoft. So first, a comment. I love that case that you showed about exchanging the data from different chronic diseases to understand that there was a specific community that had more of that. I like that idea a lot, because we tend to isolate the chronic diseases and work on that. And also, because when we talk about medicine, personalized medicine, we tend to think on genetic. And there was a discussion that I'm having with several doctors here, because there's a couple of doctors that push for the genetic is important, but the environment is even more important. And sometimes we are investing in very expensive medicines for the genetic part, but we are not looking to the environment. And seeing that used here is for me, it's very insightful and important. My question is very practical, probably more for Nunu. So on all of this has this spate of data, a lot of data coming from public sources. So do you see this data being available also for Portugal? I understand that the cases that you are showing is more on US, but do we have this kind of data available on Portugal?
Of course.
Well, in fact, we have a lot of information. So we have some information, meaning statistical information available at national level, and it goes as far as all the information on population and also regarding health, and also our Ministry of Health also holds a lot of information on patient characterization and health services. What's missing most of the times is to invest more in gathering this information and make it useful for analysis and decision making. And when the information is missing, we also are able to provide the tools to allow for the acquisition of this data. It's a question of will more than a question of skill.
Yeah, okay, you answer me. So most of this data is available. If we want to use it, that will be easy to do it. Thank you.
Thanks also for your comment. You sort of hit on exactly why I love this field. I was in academic medicine for a long time, and taking care of patients one at a time can be very fulfilling. But when I saw that, 80% of our outcomes are determined by our context, I thought, wow, what a difference could we make if we think this way too.
And I think the example was quite clear in terms of what we can do prior to having them coming into your office, right? And then so if you can do prevention, it's a lot better than just working on cure than that.
It is. It's just harder to sell. I mean, I always give the example of in clinic, we'll tell patients, okay, you've got to exercise, you've got to eat right, you've got to do it every day, you've got to get all of your screenings, all of your vaccinations, and you do all of this so that in the end you get nothing. And it's very hard to convince people to do a lot of work to get nothing. And it's it doesn't seem concrete enough. I mean, mostly you do things and you get something tangible. So, so it is a little bit harder to get people to look into the future and see what's possible and focus on prevention and the benefits of that to society.
Yes.
But why
And
we
we
wait?
tend, sorry, I was just going to say that we tend to use the same labels for localization that we did, I don't know, 30, 40 years ago. So like postal code or something like that. Because they were created to help us move around cities and the country, but that doesn't mean that people are organized in every way in that area. So, and when we tend to do those analyses by, for example, by district, but that doesn't mean anything in terms of population because it depends a lot on where people are staying and their conditions inside a district. It's very insightful and thank you for the presentation and all the examples. They are very powerful.
While we wait for other questions from the audience, I'm just going to do a comment and then maybe if you can share us a little more about it. One of the main issues we face in our national health services is the challenge to match the limited resources to an increasing demand. And this differs across health specialties as well as across health regions, both in demand as well as in offer. The New Jersey example you shared, it looks like, to me, it looks like an inspiration on how GIS is useful to help tackle on this. In Portugal, recently there's been, I work for GIS, I'm not a health specialist, but what I, at least the information I get from the news is we're lacking, for instance, in a specialty that you also mentioned, which is the lack of doctors of, it's in the word here, obstetrician.
Yes.
How to say it. So we're missing a lot of obstetrician services, and but this could be to any other different specialty. So the question is mostly: do you have examples on the optimization of services and share resources between service areas to address a demanding population?
I think I have an example that you might appreciate. And this is an example around homelessness, because I think one of the interesting things is that you have this general problem of not enough resources, but a high demand. That's your premise. But we know that our leaders tend to have different opinions about how to, their agenda for meeting that demand. So homelessness is a really nice example because some leaders believe that homeless services should be centrally located right where most homeless people are in a city. So everybody kind of knows where the services are and they just have to find their way there. Others believe that, the way that you allocate resources is to put them in the communities where people are at the highest risk of becoming homeless, so that you can maybe prevent that or keep people in their communities where they have more social support. Others believe that you should have more of a social equity kind of resource allocation so that it's fair to every community to support some of the problem around homelessness. And there are about 7 other different agendas. So one of the things that you can do with mapping that turns out to be really great for consensus building is you map each political type agenda. What does it look like if we say we're going to put it in the place where there's the most homeless people? What does it mean? What does it look like on the map if we're going to put the resources where people are becoming homeless? What you'll find out is that there are places that overlap, that everybody can agree are good places. It meets everybody's agenda. And so that's another sort of method for allocating resources when you have a lot of disagreement. But then you saw the example with the obstetricians where you're simply focusing in, trying to meet the greatest demand area, which is another sort of agenda, right? If you take care of the most needy who are probably costing your system the most dollars, then you will have more resources later to take care of other groups that are slightly less in less dire circumstances.
Thank you so much. Any further questions from the audience? You just need to, you can address directly, just need to unmute the microphone and go ahead.
I saw something in the chat as well, but I cannot read
The
it.
chat is information sharing, really sharing how
Okay.
they can access the data.
Okay, great.
I think you've been very clear during the meeting.
I was just explaining that the Azure demographic data may be used to different areas, not only the administrative ones like counties, municipalities, or wherever, but you can do a buffer or a service area by 10 minutes from your healthcare institute and get the characteristics about the people who live there, the purchase power, this kind of stuff. So it's not like an administrative pre-processed areas. You can choose your own area and get the data from that.
Well, so I guess there's no further questions. I mean, the name of all the organization, so the report, there's a Portugal as well as Microsoft Portugal. I'd like to thank your availability to come and share with us your insights and our experience in other geographies. I hope the content was useful for national health practitioners, let's say so.
I hope so.
And hopefully for all of us as citizens, because this is a matter of public interest, let's say so. And so if there are any further questions, the audience sometimes in Portugal, it's useful. It's usual to be a little shy and doing questions after the events. I'm sure some questions will come afterwards.
Please.
So feel free to address it and do any questions further on. Basically that's it.
Sounds good.
Thank you so much.
Thanks, everybody.
We will have I'll just address them em português. Espera lá. Se tiver alguma questão, podem colocar-nos a nós diretamente nos nossos e-mails. Eu vou só partilhar aqui um e-mail mais fácil se tiverem alguma questão. E penso que vou ver se os slides depois ficarão disponíveis, foi uma das questões que me colocaram. E depois também, se quem precisar de aceder aos slides, também pode nos enviar um e-mail e também vamos verificar isso. Tá bom? Obrigado e bom dia a todos.
Obrigada.